Hello, I am Bobbi-Jo. It's great to have you meet with us today, and thank you for being willing to kind of share some of your experience. If you want to just get started by sharing your name, pronouns, and just a little bit of, kind of basic information about yourself.
Sure. So my name's Rebecca. Pronouns are she, her. I'm an occupational therapist. I'm late identified neurodivergent, chronic illness stuff going on, long history of mental health stuff. I live in New Zealand in a little tiny town at the top of the South Island. I have a dog, live in a tiny house. Yeah.
All right. Well, tell me a little bit about how you came to learn that you have ADHD. Kind of what was that process like for you?
It was the domino effect of female friends being diagnosed one after the other and going, I'm quite like you guys. So I am both autistic and ADHD. And so I was diagnosed the end of 2022. I can't say last year now because we're in the new year. So it's been just over a year. And I wasn't at the beginning, I was more convinced about autism rather than ADHD. I wasn't 100% sure that ADHD was part of my picture, but the diagnostic pathway for ADHD was a bit more straightforward. And
Hmm.
so I went that way and asked them to screen for autism at the same time. And then it was like, yep, you're both.
Yeah. How has having that identified changed your life or impacted your life at all?
It's been, I mean, it's been a whole journey, like, because it's still pretty new. A year's
Hmm.
not very long to kind
Yeah.
of, I'm in my mid 30s, so I've had a whole lifetime of thinking I was broken and different and all the other things we think when we're late identified. And so it's been this real journey of this cycle of like grief, relief, acceptance, kind of over grief for what I might have missed out on or not knowing earlier, or just little me who was felt so alone and separate, and relief that like, oh, there's a thing. It's not that I'm broken, it's that I'm wired a bit differently and that's actually okay. And so that's been this amazing pathway into more self-compassion
Mm-hmm.
and working on shifting the way I live my life to more support my neurotype. I'd already been doing a bit of that because I've had chronic illness for 10 years, which likely started after a period of autistic burnout, looking back. But yeah, just that being able to go, okay, I'm really sensitive to these things. How can I do things a bit differently? Or, okay, working in an employed role is not fitting super well. I'm going to set up a private practice, which is what I have now. And I've actually just left my employed role completely to have
Okay.
self focus on the private practice so that I'm not split focus and I can go with the monotropic interest.
Yeah. Are you finding, I mean, do you feel like a big piece of that move was to be able to kind of fully support your own needs? Obviously, when you're employed by others, while some places are really accommodating, there's also still some limitations, right? Of where when you're fully on your own, you really can set up your business 100% however it works for you or what you need to.
Yeah, and I think just that knowing more about how I tick and just being able to like accept that and support that, and my word of the year is authenticity, and how to step into that more and support myself more and being okay with us for asking what I need and for going, actually no, I don't fit in this system and I don't want to fit in this system. I'm going to create my own box.
Hmm. Yeah. Shifting a little bit to talk about just kind of your experience in therapy, approximately, how many mental health therapists do you think you've worked with in your lifetime?
Yeah, this question, I was trying to think about it. And like it's been a long journey with lots of different people, some who have been super helpful, some who have been awful. Kind of starting from school counselors when I was about 12 or 13, when things started going downhill for me mental health wise, which is quite common with neurodivergence.
Just gonna say, hormone
Hmm,
changes right at that
hmm,
age.
hmm.
Hmm.
Yeah, so yeah, starting right then with school counselors who were not helpful, had some involvement in the child adolescent mental health services, which was again not at all helpful. And then as an adult, kind of seeking it out for myself and being able to choose who I saw. And again, that was really mixed. So if I had to put a number on it, I'd say it's at least 15, possibly even more, because there's
Okay.
also been, I've seen psychs through pain programs and stuff for my
Mm-hmm.
chronic illness. So it's kind of this whole combo of the
Different kinds
complex
of
combo of
supports.
things that
Yep.
I only later added ADHD to my picture.
Yep.
And so there's been a lot.
Yeah. Has ADHD ever been, obviously, you've only had that identified in the last year. Has that ever been kind of a primary reason for seeking therapy?
Not really. It was always kind of more that depression, anxiety, but that was never the answer. Like I always knew that it was more than that, because we kind of look at those things, but I was like, but there's stuff underneath
It
it
just
that we're
doesn't
not,
quite fit. Yeah. Yeah,
yeah,
I
that we're
think that's
not,
a common feeling, right? Of like there, you relate to pieces of it for sure, but there's often it just isn't quite right. That was my experience, initially the first little while was looking at depression, and I actually now question whether I ever truly had depression or if it was just pieces of ADHD, like, kind of the getting stuck piece of ADHD and things like, other pieces with that. But yeah,
mm,
um, yeah, it's definitely, obviously lots of people have complex stuff. It's also interesting for folks who are new or identified. Sometimes when you look back reflectively, you may have never stated that, it was those things, but when you look through that different lens, you're like, oh, actually it was, I just didn't know that. In some cases, of course,
yeah,
there can also be stuff that's completely unrelated, although almost everything relates back somehow.
yeah. So yeah, I think a lot of mine was more related to, yeah, that kind of depression, anxiety, what I now know as sensory sensitivities, um, some like complex trauma stuff as well. And I think the ADHD got a bit hidden
Mm-hmm.
in in all of that. And because I've always been quite organized and I had my systems until I burnt out,
Mm-hmm.
so I think in some ways, how sometimes autism can mask some
Mm-hmm.
ADHD symptoms,
Yep.
that yeah, the what was kind of up on top wasn't the ADHD.
Yeah. Yeah, you mentioned before, and I guess you could talk about this just generally, whether it's directly related to ADHD or not, kind of given that context, but any specific kinds of unhelpful therapy experiences that you want to share about?
Anything to do with cognitive behavioral therapy for me. It's an amazing therapy for some people. It can be super helpful. For me, who was already hyperanalyzing my thoughts, because a lot of my hyperactivity is internal. I was diagnosed inattentive ADHD, but my hyperactivity is internal. My brain is
Hmm.
never shutting off. And so putting more focus onto my thoughts was really unhelpful. And having people continue to push things that I was saying wasn't helpful
Hmm.
as well. So that would kind of be, yeah, that would kind of be the main thing. And just like people, I don't know, like I remember as a teenager really struggling to engage in therapy. Like I would spend whole counseling sessions looking at the floor because it was forced. I was forced to engage with the
Hmm.
child adolescent mental health services. And I was like, well, there's nothing wrong. I've got all these feelings, but there's nothing like objectively wrong in my view at the time. There was lots of stuff, but so I didn't feel like I had anything to talk about. And I was in full shutdown mode as well because it was forced. I didn't want to be there. I didn't know the person. I didn't get to choose them. So it was a very different experience in that kind of forced system, as opposed to later on when I was able to choose my therapists. And I would give people a call. I hate phone calls. This is like one of the only times I'll make a phone call, but just to do a vibe check. And I could get a read on somebody in a 5-minute phone call
Hmm.
on whether I thought that we could probably work together.
Hmm.
And so that's one way. I mean, I still, yeah. And then money comes into it and who's affordable. Some people
Yep.
do a sliding scale, some don't. So
Yep.
there's all of that. Um, and I think some of the other questions are about what was helpful. So maybe I'll leave.
Yeah, you can jump into that if you want to.
Yeah.
Is there anything in particular that has been really helpful for you, either related to ADHD or, just generally?
Yeah, I think there was kind of a series of different therapists who had slightly different approaches that all built on each other. So there was one who did some acceptance and commitment therapy, and that landed heaps better for
Mhm.
me, with some mindfulness stuff. And then I did some cognitive analytic therapy as well because I couldn't get, I was diagnosed with borderline personality disorder in my late 20s. And whether or not that's still a diagnosis that fits in the light of autism ADHD, I'm not sure. But at the
Mhm.
time, it was really affirming and validating and made a lot of sense.
Sure.
And I couldn't get into a dialectical behavior therapy program. So I did some cognitive analytic therapy. And that was really useful because it was visual, it was mapping. You kind of look at what's this thought and a response or a feeling and a response, and you do these little boxes that all link to each other, and it was really visual, and that was super helpful rather than just it
Mhm.
being talky.
Yeah.
um, and then did some stuff with the psych and physio through pain sides of things, and again like diagrams and drawing things out, and that I've always really liked that practical written, like taking notes or doing things written. And then in the last few years, I've kind of shifted therapy into trying to get out of my head and into some more somatic and body based stuff, which I'm struggling with because I want to stay up here and analyze it and
Yep.
write things down and do my homework and
Yeah.
be a good therapy patient. But needing to realizing that more and more my nervous system is on edge and is always on edge, and working on how to support that, bring my agitation down, learn what my body's telling me, listening to it. So that's kind of
Mhm.
the process that I'm in now. And I'm also interested in potentially next exploring some trauma, like specific, like EMDR stuff,
Mhm.
and just seeing, yeah, I'm just in that kind of like, okay, what's going to be most useful for me next?
Mhm.
And being an occupational therapist and working with people, sometimes I'm like, oh, is it okay to talk about my own therapy? And but I also think it's important that we as health professionals do talk about the supports that we get. It's like it doesn't
Yeah.
mean that I can't do my job and can't be a good therapist. It actually makes me a better therapist
Right.
because I'm working on my own stuff, so I don't need to bring it, and
Exactly.
I can keep it.
Yep.
I can keep it for me, and maybe things that I've learned in therapy are useful.
Mhm.
So yeah, I'm kind of just noticing some of that come up as I talk about some of my personal stuff, but I'm also very much, my whole private practice is about my lived experience.
Yeah, and I think it is really important that, um, because I work from a lot of relational types of models and things like that, the more you dig into that, the more you really become aware of how much your own stuff impacts your responses to clients, right? And when you really start to notice those kind of things. And so it is super important to do your own work, even if it's just for the sake of, you know, your clients and being able to really not have the parts of us that get activated show up in our work that we do with our clients. And so I
Mm,
believe that it is important to be transparent. I also know, I also know how I present in my own therapy sessions is vastly different than how I present with my clients, which I think is a really important thing for folks to know. I mean, I think we hold helping professionals to this standard sometimes in their personal life, and we like forget that they're humans and they get to do that. And we can't make assumptions about how somebody acts in one setting versus another because I mean, we all do that, right? Like we are different with this person we're really close to and with this other person in our job role. And so I think it's important that folks understand those differences of and not make judgments of just because I have this unprofessional experience with somebody personally doesn't mean they're not great and don't treat their client super well. You're not their client. They don't owe you that. You're just a random stranger on the street. Um,
yeah, and I put it in the box of, well, that's part of my self-management strategies. It's one of my self-management strategies. There's a lot of others, I also
Mhm.
see a naturopath and an osteo,
Yep.
and and then there's a whole bunch of stuff that I do in my own life at home to keep myself well, to be able to
Yes.
show up for the
Yeah.
people I work with. And so for me,
Yeah.
therapy is one
One of
piece
those
of
pieces.
that. Yeah.
Yeah, absolutely. Do you feel like you can kind of be 100% yourself with your therapist, or have you felt like you've needed to mask, some of that in some sort of way?
Um, it has depended on the person. And again, that's part of me having, doing the phone calls, is to actually check, okay, what kind of sense do I get of this person? And if they're not willing to have a phone call with me, they're probably not a good fit anyway.
Mhm.
Um, it's why, so in my practice, I offer people a half-hour chat with me before they decide we work
Sure.
together, because I don't want people to spend their money and then go, oh no, I don't think it's going to work. I think that's really
Mhm.
important. That wasn't what you asked. Um,
That's okay though.
um, oh no, I've just actually
You're
literally
doing
forgotten what.
you're doing the checks to kind of see if you feel like you can be yourself or not, is what you're telling me.
Yeah, yeah. Um, so I think, yeah, it has varied, and I think with identifying the autism and ADHD, I've, like with my current counselor, I sit on the floor, I lie down, I sit sideways with my legs up on the chair. She has lots of toys and things in her room that I can fidget with. We do various, like the other day we were mapping out some parts, and she has all these little dolls and stuff, and I like actually mapped them out with things and rocks that were in the room. And so, yeah, I feel like much more now, because I didn't know that I was masked before.
Mhm.
And now I can see how much I was. And so I think there's been various therapists that I have, like when I was doing the cognitive analytic therapy, I had an amazing, actually I had two different ones, because one moved away. And we would sit on the floor in our sessions, and that was nobody questioned that
Mhm.
was okay. So I think, yeah, the last few I have felt, but before that it was very much you sit in the chair. And yes, I was sitting cross-legged, but I wasn't fidgeting, and I wasn't,
Mhm.
actually doing the things that I needed to stay present and regulated to have a
Yeah.
therapy session. So that would have impacted my engagement, because it's like, oh no, in therapy, you sit in the chair and you look at the person and you take notes, or, whatever it
Mhm.
is. Whereas, yeah, in the last 5, 6 years, actually, since after the BPD diagnosis, I think I started feeling, therapist I was working with at the time I got the diagnosis, not so much, because she was like, I can't help you now,
Yep.
which is quite common.
Well, yeah,
But
that's
then,
that's not uncommon with that diagnosis.
yeah, so, and like she didn't mean it in a mean way, but of
Yep.
course, anyway.
Yeah.
Um, but yeah, then from after that, and the next two that I came to, and then since moving to New Zealand, it's been this, like, okay, how do I need to sit in a
Yeah.
session? Even my current counselor now, like she has like an air purifier on, and she knows to turn that off when I come in. Or I might see if it's okay, but then we'll turn it off if it's too loud. She turns the overhead light off. All those sorts of, like, the things that you don't think so much about,
Mhm.
but then you're like, oh gosh, when that noise is off, I
A
can
lot better, yeah.
actually be a lot more present, right? So
Mhm. Well, and all of
yeah,
those things that people offer or allow you to experiment with, it sounds like you've learned over time when given that freedom to identify what your needs are. So each time you know more, like you can go in and be like, I need to sit on the floor and just ask for what you need once you've realized that that helps you, or I need you to turn that light off. That's too bright for
mm,
me. Um, but sometimes you don't even know it's a choice to ask, or you don't even know that it's bothering you until somebody's helped you to consider that there's choices there.
yeah, yeah. And so in my own setting, like, even so, right from my initial intake thing, I ask about access and support needs.
Mhm.
And then most of my clients are online, but when people are in person, I'm like, do you want to sit on the chairs? Do you want to sit on the floor? Do we get some bolsters? I've got a little fidget box. How's the lighting? How's the temperature? Like, just all the all the different things that
Yeah.
now that I know more about me, I know to offer that, especially when people don't know that they can ask for it.
Right, which you are doing an intervention simply by asking, because you are forcing them to check in with their bodies to see what they need, right?
Yeah. Yeah, and getting them to practice advocating for themselves as
Absolutely.
well.
Yeah, absolutely. Um, are there anything, just you kind of were already getting into this, but are there any other kinds of accommodations related to the ADHD that you would want from a therapist? And this can be like, either a very realistic in the systems that happen, or like you can think real big scale, like if we, had a completely different system and world, what would be awesome?
Yeah, I guess people having a better understanding of the complexity of ADHD, its impact on basically everything, and how it's often co occurring with a bunch of other stuff. You don't often see ADHD in isolation,
Mhm.
and that there's lots of different ways that it presents as well.
Yep.
And so, just how to be validating and supportive and not gaslighting. And but then amongst that also, like, your ADHD clients might need some different supports, either to be in a session, maybe you need to do sessions outside or walking, or whatever it is, that it's okay to sit upside down, back to front on a chair, that there's all kinds
Mhm.
of fidgets, that maybe you're doing some parallel play stuff even. And this is with adults I'm talking about. I'm not even
Yep.
talking about with kids, right? Because I don't work with kids. My clients are all adults. And just like how to support people to be comfortable. A lot of people with ADHD have had lots of negative voices, lots of negative things said to them that then gets internalized. So, an awareness of how frequent those can be. And so, if you're doing any work on an inner critic, how long that can take to
Yeah.
shift, and needing to model that over and over and over and over,
Yep.
and catch people when they say things like, oh, I'm so stupid, or I'm not getting this, or,
Mhm.
like adding a yet to I'm not getting this yet. Or instead of I'm so stupid, how, like,
I am
getting,
struggling with blank.
yeah, so catching those and helping them to start
Mhm.
reframing. But then also with any homework tasks, how are you setting people up for success? Like, are you just saying
Mhm.
do this, or are you going through step by step when they're going to do something? Are you watching them set an alarm on their phone to remind them to do a follow-up task? Have they written it down? So with my clients, I send a summary email at the end of a session, which will have a little, just like super quick, it takes me 5 minutes. These are the topics we covered. This is what you agreed to do. This is what I agreed to do. I'll see you next time at this time.
Mhm.
And that is an executive functioning accommodation that nobody's asked for. It's just actually something that I do, because
Mhm.
even though not all my clients have ADHD, I work with people with chronic illness who also have
Yeah.
cognitive
This is one of those
cognitive stuff
universal
going on.
design things that you can offer that will benefit anybody, right? Like
Yep.
maybe that person had to go and, right after their session, they had something really traumatic happen to them. And so they completely forgot what happened in their session because they didn't have time to process it. It could be anything, right? Like,
Yeah. Yeah. I mean, and also with that, encouraging people to start working towards taking their own notes, and
yep.
some people even doing their own summaries and sending them back to me, so that I'm kind of building their capacity. But certainly for a lot of people, I just do the summary
Yep.
because their lives are hard enough anyway.
Yeah.
So, yeah, I guess that would be another accommodation, is like, what is the homework you're setting? Does the person want to do it? Or are you setting it as well? Like, that's another big one. Are you collaboratively working on, hey, what do you think would be useful for you to practice in the next fortnight? Or are you going, do this?
Hmm.
Because I can almost guarantee you that if you're saying do this, the person won't do it.
Yep. Yeah, it definitely
They've,
has to be an
yeah,
offer with an accepted agreement. Because
yeah,
if there
yeah,
is not buy-in, and then all you really covered all those extra steps, which I think are really important for folks to know. I think a lot of therapists are like, they will bring up tools, right, with folks that they can use, but they don't take the extra steps to talk all the way through those, right? Of like, what does actual implementation look like? And exactly what you said. When exactly are you going to do this? Do you have a reminder set? Um, And I like to explain it like that, when exactly it might take a long time to even get an answer to that, because oftentimes, most ADHDers are like just getting by through the day, right? Like they have literally no idea what's happening past the next 5 minutes. And so even just asking that question of when exactly allows them to like picture themselves going through their week and thinking about, oh, well, I'm going to be working then. And you have to like account for all the time. I'm going to be working then, and then I'm going to go home. Well, and I usually eat at this time, and really thinking about, okay, well, I can't just say in the evening, 7
Mm,
p at 8:30 at night in the evening. I cannot set a reminder for a task. That is when I am putting my children to bed. And so I won't be by my phone or will be busy. And so if an alarm goes off, then it's useless because I can't do it at that time. So I need to set that alarm at that time when I actually have access to do the thing. Um,
exactly. And also like setting up for success. Like, so I'll have people go, okay, well, I'm going to do that every day. And I was like, no, you're not.
yeah,
How about we start
if we
with,
start at zero, we can't start it every day.
yeah, let's start it once a week, maybe twice,
Yep,
just
exactly.
like, because people can be like, yeah, I'm going to do it. And then they'll do it for 3 days and then not and feel like a failure. And it's like, well,
Mhm.
how can we build this into your routine? What are you going to pair it with? What do you already do every day? Okay, you brush your teeth. Not, I know not everyone brushes their teeth every day because that's a whole nother thing, but pairing it with, you have your morning coffee. Okay, take 3 deep breaths before you have your first sip of coffee.
Mhm. Much more likely
Just
to
like,
remember it than at a random time.
exactly, like pairing it with something, or getting someone to help out. Like, can the person ask a family member to do something with them or remind them to do something? If you've got kids, can you teach your kids a cool breathing exercise so that it's a game and you want to do it? And then
Mhm.
there's that other, what's the acronym? Is it INCUP? The interest, novelty, whatever they
Challenge.
are. I
Yep.
can never remember acronyms
Urgency.
off the top of my head.
Yep.
Challenge, urgency.
Yep.
Yeah,
ICNU, and then I add an A to it for accountability, because I think
yeah,
that is an important to add in there, because that's actually usually the one that we go to when all of the rest don't work.
yeah, yeah. So yeah, you're gonna do this. So working with the client to go, okay, so you're gonna try this, you're gonna do this, not even try it, you're gonna do this twice a week when you do this thing, and then we'll check back a minute in about it at on this date. So having that accountability piece, I think, is really important as well. But just like working with people, if somebody is repeatedly not doing their homework or not doing the things you might set outside of session, well,
Get
there's
curious
no
about
point
that.
shaming the person. Like, yeah, get curious. What is going on? What is getting in the way? Was the task too big? Have they just got too much else on and they actually don't want any homework for a while?
Hmm.
That's okay too,
Hmm.
where you just do the stuff in the session and stuff will still carry over.
Yep.
Like, some of it will go in somewhere.
Yeah, and sometimes I think that's the important piece too, is it's good for a therapist to know that progress may take longer, but it doesn't mean that progress isn't happening, right? So like if they aren't doing things outside of session, that's okay, because whatever they're getting in your sessions is valuable. It just might take longer because there's not as much repeated, practice, but that's
Mm,
fine.
yeah,
Again, it's better than what they were having before support, which was nothing, right? So, um,
yeah.
yeah, so I think that's an important um, adjustment or expectation for therapists to think about. Um, I think you've kind of already answered this with all the stuff you just shared, but is there anything else that you would want to share with therapists about how to best support somebody with ADHD?
I think most importantly, it's being validating and compassionate. Really, I think it really comes down to co-regulation and kindness, because a lot of people, not just with ADHD, but it gets talked about specifically, like kids with ADHD, well, like 20 times more negative comments in their life. So just being aware of that. I mean, the complex trauma of that
Mhm.
as well. So actually, that's another thing that I think, to be neurodiversity affirming, you have to be trauma informed,
Mhm.
and not just trauma informed, but like actively aware, and
Mhm.
not necessarily knowing how to do trauma work and trauma processing, but
Although that's ideal.
understanding,
Because it's
under,
there, right? Because then that's because I mean, I'll be honest that I think if you want to specialize in that, it is really important because otherwise, you know, most all of that you've shared about, that shame, that trauma is there.
Yeah.
And so either you're going to need to refer somebody out, which we know for ADHDers, asking them to do more with more providers is unlikely to work great. And that goes back to that slower progress, right? I think is that like I know for myself, I am very flexible. Sometimes somebody needs some really direct, concrete support today, like help me organize my schedule because it's too overwhelming for me. And then the next time we might be doing really deep stuff about that time when they were 5,
Yeah.
that's impacting them now in the current, in their current life. We can move back and forth between those things. Okay. Again, it might take longer to see the same amount of progress because we're not following a typical protocol, but there's times that being able to have that flexibility and just meet them where they are on that particular day is so helpful.
Yeah, I think that's really key too. And part of being trauma informed is being able to be flexible. It's like you might go into a session with a plan and have to completely throw it out the window because of how somebody shows up in your session. And that is better, meeting them where they're at rather than pushing through with something that's not going to work anyway because they're not in the space to take it in.
Which goes back to the co-regulation, right? Of before anything's going to happen, regulation has to happen first. So
Yeah, yeah. And the more I'm learning about the nervous system and all of that, I'm like, it's all coming back to that.
yeah, I mean, that's really my kind of key underpinning, and where I'm at right now because I work on a training on ADHD trauma and nervous system lens,
Yeah.
and trying to pull that all together. But yeah, it really is a big piece, and it's complex, which makes it really challenging to even
Mm.
provide education about and fully understand. And ADHDers are kind of just naturally wired in a different way that our nervous systems, even at rest, before all of these things happen, are doing very different things. And I don't think we have great research on that. I mean, we have enough research that supports that they are different, but that's about where we're at.
Yeah.
Nothing super concrete, and so um, yeah, it's interesting, but I think having those underpinnings around and having a kind of nervous system understanding is super helpful, and just being aware of that.
Mm.
It's
Yeah.
also super helpful. This is my own little plug that having that understanding, I can't tell you how often with clients going back to the non-shaming, the nervous system lens and just being able to use that to give people perspective on what's happening for them. It's so non-judgmental because it's based on our natural survival instincts that we don't have conscious full control over. And so when you're able to say to somebody, you lashed out because your nervous system felt unsafe because it reminded them of this other thing. Well, that makes sense. And I don't have to feel like I'm a horrible person. It's just what my nervous system did. And it's amazing how much I can literally see shame like melt away as you start talking with people about that. Um, it doesn't mean there's not consequences from our responses that we have to still work through,
Yeah.
but
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 without the shame, that reflection is so much more possible
mhm.
because instead of being, I am bad, it shifts it to, this wasn't okay. And I can
How do
understand
I
why it
work on my
happened
nervous system so this
and how
doesn't
I
keep
might,
happening?
yeah, how I would do it differently next time. I think that's the key thing. I love Brene Brown's stuff about shame and
Hmm.
like it shame gets really stuck and
Hmm.
takes a lot of work.
Yeah, for sure. Is there any specific kinds of ADHD management strategies that you've picked up just anywhere in your life that have been kind of a game changer for you?
It's hard to kind of tease out what's maybe specifically ADHD versus
Sure.
autism versus chronic illness, like,
Yep.
because I do a lot of self management stuff just to keep living a life.
Yep.
So for me, writing everything down is
Hmm.
huge. My working memory sucks. So yeah, I set reminders, I've got different lists. Like I've got one for my business, one for my personal life, one for professional development that I want to do, one for Facebook posts I want to
Yep.
make. So yeah, writing everything down. And that's in sessions as well,
Yep.
with clients. And I think, and again, this is not specifically ADHD related, but it's that more the coming back to the self-compassion and going, oh, it makes sense that I'm so exhausted. I've actually just, you know, or actually one thing I've been doing recently is catching myself when I'm looping in circles on my computer, when I'm
Mm.
not actually getting into the training or the email replies or the worksheet development that I was planning on doing. And I'm actually just in a bit of a loop of not making
Clicking
progress.
between windows and reading, but not really doing anything. Yeah, I'm familiar.
Yeah, I'm like, okay, I'm gonna close my computer and go to a little yoga practice or spend some time in the garden or read my book or watch a show. Like I might not always close my computer. I'm
Yeah.
not demonizing screen time. Um, but that, okay, this is not the time right now to be forcing my brain into doing something. Another thing I do is I don't see clients before, I think at the moment it's actually 1 o'clock. So that's an accommodation for myself. I take a long time to get going in the morning. It's why I'm glad the time difference worked for us, that we
Yeah.
started this interview at 11, because earlier than that would have been really challenging for me to actually be able to put words together because my brain is still waking up. And that's
Hmm.
even with taking meds, like, as soon as I wake up, it can still be a 2 or 3
Yeah.
hour process to actually feel like I can engage. So often, say I've woken up at 8, I'm not actually ready to use my brain until 11.
Hmm.
And so I don't plan things that need my brain until 11. And this is part of, leaving my employed role, is I had to start work at 9 o'clock. My
Hmm.
brain wasn't ready to
Yeah.
be starting work at 9 o'clock. And now I don't have to. I can,
Work with your
trainings and
natural kind of rhythms and
yeah. So trainings and stuff, I don't have control over that necessarily. So I'm doing one at the moment that does start at 9, but I'm doing that in my pajamas from my bed with my
yep.
laptop,
Yep.
off camera. So I think, and yeah, that's not specifically ADHD related, but hopefully that's
Well,
relatable.
it can be though. I mean, I was gonna just because I know I haven't talked about this and it hasn't come up specifically in the interviews I've done so far. I mean, um, the it is really common for ADHDers to have kind of a delayed sleep phase and delayed circadian rhythms, and so which I don't think is very well known as a thing, right? And so that's another area where I think therapists often, just because they're not aware of it, people make, we morally in our culture make judgments about waking up early and, but what does it matter, right? Unfortunately, a lot of us have circumstances that like we don't get to fully control how things are
Yeah.
done, or sometimes just the way society is built, bank is only open from this hour to this hour, so I have to be functioning in a certain time period to get things done. However, there are, real differences for many ADHDers. And so just even being aware of that and normalizing that, um, and trying to help people learn more about that and understand that. And if they can accommodate themselves to just go with it, that's great. And if not, it can at least take the shame though, again, away from that, because that's where I think a lot of therapists don't understand all the ADHD and sleep correlations. And so then even though they're attempting to be helpful, there's always an assumption, well, you must not be going to bed when you say you are. You must not be doing this if you're not waking up ready to go for the day. And I, as somebody who experiences that myself, like and I also have had insomnia on and off. I mean, I can tell you that like pretty much anything over 6 hours of sleep, I have the same amount of energy, whether it's 6 hours or 10 hours. Now, there is a minimum, like six is about my minimum. Below that, I'm not functioning as well.
Yeah.
But it also doesn't matter whether I had 10 hours of sleep. Before about 8:30 a.m. for me, I'm not super awake and ready to get up, right? On the weekends when
Yeah.
I'm allowed to sleep and I don't have a child interrupt me, but consistently I'll wake up between 8 and 9 a.m. when left to that. And I'm okay then. I don't
Mm.
have nearly as much of a hard time getting out of bed as I do before then. Now I can do it, but it is a struggle regularly. And so, yeah, there's a lot of those, just those pieces that therapists then make a lot of assumptions or will keep trying different techniques and things like that that end up creating more harm or make the person feel like they must be doing something wrong because none of these things are working, when if your body's literally on a different you know
Yeah.
a different internal schedule, um, either you need some real specific strategies to see if you can work to shift it that are much different than what we normally think about. So there's a lot to that as well.
Yeah, I made a resource last year on like adapting sleep hygiene advice, and it was more from a chronic illness angle. It wasn't specifically ADHD, but it was kind of looking at the advice and going, do what works for you.
Yeah. Yeah, and that's exactly, and I'll be honest, I think my lived experience has helped the most with that, right? Like, because I know, like, firsthand, I have done all those sleep hygiene things and still had insomnia. And then there's nights that I do everything wrong and I sleep okay,
Yeah.
right? Now, I'm not saying all of it's garbage, because sometimes there is some truth and it helps to some extent, but then there's other times where, again, you're following everything and it still isn't doing anything. And so, um it's complicated, I guess, I think, is the like final piece. It doesn't hurt to try sleep hygiene stuff and to kind of go through that checklist. And it's also, I just always validate for clients, you might do all these things and still have struggles,
Mm. Yeah.
and
And
so
then that brings up for me, like thinking about, so if you've got a client with a 9 o'clock appointment who keeps missing it, well, is a 9 o'clock appointment the best time
correct.
for them?
Right, exactly, yeah. So just trying to work with them to find a time that would be better,
Yeah.
or and I think, because it's always important for therapists when we talk so much about accommodations, providers are allowed to have boundaries too about what works for
Yes.
them in their own life, and that those can be neutral kinds of things, right? Like, you, if my life doesn't allow me to have later appointments, that's fine. I can just say, like, it sounds like you really could benefit from a later appointment. Unfortunately, I don't have, the ability to offer that right now, and so where do we go from here?
Mm.
And it can be a neutral thing. It's not about me, it's not about you. It just is what it is, right?
Mm.
um and but I think even being able to approach it in that way is so much more gentle. There's less trauma and abandonment issues if a referral does need to happen, all of those kind of things that unfortunately often end up not being handled so well otherwise. So,
Yeah.
is there any last kind of things that you wanted to share or that come to mind that we haven't talked about that you feel are important?
I guess the maybe something in the late identified piece is that whenever I see that someone's had depression and anxiety, or they talk about having had depression and anxiety since they were a teenager that has never gone away, it's probably more than depression and anxiety. And
Mhm,
just being, as a health professional, or as a as a client, maybe there's something else underneath it, that
mhm,
you may absolutely have depression and anxiety being caused by an undiagnosed neurodivergence of some kind. I mean,
yeah,
it could be treatment resistant depression, absolutely.
mhm,
I always question. I'm like, that's a long time. These things haven't worked. I wonder if there's something else going on. And if I'm going to bring that up with a client, it's very gentle. I'm not implying that somebody has something. As an occupational therapist, I can't diagnose.
mm,
And so, but what I can do is help somebody explore what's happening for them. And
mhm,
is this happening, or how is this impacting on your life? And do you think there's something else going on here? And I mean, for me, and I've said this to clients, it doesn't matter to me whether they've got a diagnosis, because I will work with what we're seeing and what's impacting the daily life and occupations, the things they do.
mhm,
But if somebody wants to and thinks that a diagnosis would be valuable, then we can explore that. and what would be the best way for you to go about that, and do you need some help setting, breaking the task down. A diagnostic
Mhm.
process is a lot of executive functioning
Yes,
steps.
it is. Absolutely.
And just how, or does somebody need help setting a budget and a savings plan so that they can go for a diagnosis, or exploring the values and why they might want a diagnosis as well? So while I, as an occupational therapist, don't diagnose, we can work on a whole bunch of stuff around that. And then, they might go and get a diagnosis and come back and be like, hey, because I do, so I'm private pay only, because the executive functioning and the having to be accountable to a system I don't agree with is not where I'm at right now.
Mhm.
That's a privilege for me, and I know that cuts off a lot of people, and I am looking at ways where I can get funding to be able to offer some sliding scales. Anyway, tangent.
Mhm.
But being able to, oh, no, my tangent took me too far away from my original point. Yeah, being able to support people and having people self-refer where they might have had a recent diagnosis of ADHD or autism, and going, what does this mean?
Yeah.
And it comes down to I'm having a lot of people ask about identity. I do values work. People having, especially late identified, and they're like, what does this mean for my life? What do I need to go doing forward? Can I continue doing the job that I've been doing, that is burning me out and is not suitable for what I'm doing, and exploring how life might need to look a little bit different. So I think in terms of mental health space, it's, I don't separate, well, in the big neurodivergence umbrella, mental health conditions come under it anyway. So you don't have to separate them out. But I
Yeah.
guess what I'm thinking about here is that a lot of the mental health systems aren't well equipped with the autism, ADHD, dyslexia, dyspraxia,
The
tics,
executive
like
functioning types
the
of, yep, yep.
or the sensory stuff.
Mhm.
They're not super well equipped
Yep.
for that, or they're trying, like, when I just after I got diagnosed and I was wondering if I could get supports for ADHD or autism, each one of them, I can't remember which way around, one of them sent me to disability and one of them sent me to mental health, and neither of them would offer support because they both said it was the other one's responsibility.
Yep.
And so I guess from a mental health perspective and from a therapy perspective, thinking about the systems in your country and how difficult it can be to navigate that, and what gaps are people falling through,
Yeah, I'm wondering
especially, yeah,
as you,
that late identification.
yeah, I was wondering too, as you were talking, as just if you would mind talking a little bit about that scope with occupational therapy, because I will tell you, I like to consider like I am a social worker, so like we are all about resources and referring. And honestly, I had no idea that occupational therapists did some of the work that they did until my own child was referred for occupational therapy. And then as also as I that was around the same time I was diving into all the neurodivergence and neurodiversity affirming work. And so I became a lot more familiar with like a broader scope. But I admittedly, my experience before was, my dad did some occupational therapy after he had a stroke, so he could learn to, cook food again and stuff like that. And
Yeah,
so, would you mind just talking a little bit about, and I understand from what I have gathered, it's very each person practices differently and everybody's been trained differently, just like in mental health therapy as well. But would you mind just talking about that? Because I think it's important for other people to have more information about what occupational therapists all can do potentially.
yeah, yeah. And this is, so it's kind of, I guess, it's turned into a special interest, and why I have my Facebook page, and I am an occupational therapist and I represent that, and it is important for that advocacy piece of talking about what we do, because yeah, if your only experience and interaction with an occupational therapist is after an elderly parent's hip replacement, then that's all you think they do. Oh, it's over toilet frames and adaptive cooking stuff. It's like, well, yes, and so there's the core premise of occupational therapy is we are supporting people to do the things they want and need to do. So
And can you
their
also
occupation,
define occupation? Because I know that's a
exactly.
hang up for a lot of people.
I was just about to get there. So I actually had to do this with a client the other day who was thinking occupation was only work. And
Hmm.
so this is sometimes a complicating factor of people go, oh, but I've got a job. And it's like, well, it's not what occupational therapy is about. It can be, but so an occupation is any way you spend your time. So that could be having a shower is an occupation, having sex is an occupation, from a mental health side, self-harming is an occupation, and drug use. Some occupational therapists call them dark occupations, and but we look at why they're happening and look at replacements rather than just going, oh, don't do that.
Hmm.
So yes, it can be work, it's self-care, it's leisure, it's things you do for fun, and it's impacted by your own factors as a person, your own capacities, strengths, things you need support with. So we'll look at those. We'll also look at the occupation itself, like what are the things in there that are difficult, what's supporting, what's a barrier, what can the person do, what's difficult, what do we maybe need to adapt, does it need to be more visual or more colorful or less overwhelming. But then we also, and this is what I love especially about occupational therapy, is we take into account the environment around the person. And the environment is not just the people, and it's not just the house, right? The environment is institutional. It's funding systems, it's culture, it's stigma, stereotypes, beliefs, values. It's the whole systemic
Yep.
picture.
Systems theory, right?
Yeah, very, very systems. And it's an interesting, I think a lot of OTs, and I'm seeing this in some of my Facebook groups, there's a lot of neurodivergent OTs because systems thinking really suits
Yeah.
brains that make connections between random things. And
Hmm.
and that's, it's an asset. I'm not calling it a superpower. I struggle with that, but in some ways that stuff is an asset.
Hmm.
Like there are lots of difficulties with ADHD, but my hyper-connected brain that makes connections is absolutely an asset in occupational therapy client work. So that's kind of the like theoretical how we might look at things. But so you can see from that how broad occupational therapy can be. And so then it will depend on the setting someone's working in, what they're doing. Like a school-based OT will look quite different to an orthopedic post-surgical
Yeah.
OT. And so so I'm a mental health OT, I guess is what I'd call myself. And I work in the community. So I'm not attached to a hospital. I'm not attached to a
So people
program.
could come for a variety of reasons.
Yeah. Yeah. So I see people who maybe it's something really specific and they just want some help with accommodations and executive functioning at work. Or maybe it's more holistic and it's like my whole life is a dumpster fire and I need some support putting strategies in place. And so there'll be overlap with social work, there'll be overlap with counseling and other things. But I guess at the core, where we're coming from that's different is the occupation is at the center. So can the person do what they want to do? What's getting in the way? What's supporting them? And so we're not looking, with ADHD, we're not looking at curing. We're looking at a lot of the supports are external. And it's not necessarily about changing the person unless they want to, obviously.
Hmm.
But it's not about changing their brain. It's about getting systems and strategies and supports in place that support their brain to do the things they want to do.
Hmm.
And for every client, that looks different. So I will ask some of the same base questions to get an idea of where they're at, but then what we work on will be very different. I mean, like I said before, I am seeing a lot of identity stuff, values, self-compassion's another big one. And also that occupational therapists can be trained to do trauma therapies like EMDR and all sorts of stuff as well. So occupational therapists can be mental health therapists in the same way that social workers can train, it's different to
Hmm.
psychology, but we can do the same things with that extra training.
Yep.
So hopefully that clears it up a little bit.
Yeah, yeah. And I think again, I guess, do you have any advice for folks? Because I know many people that have become aware of occupational therapy, and some of this might just be more, I'll acknowledge it might just be I'm in a rural area in Iowa that has very few resources and so and is not the whole state, is not really having a lot of neurodiversity conversations. I'm trying to do a little bit by bit what I can do to change that, but and so um like how does somebody know where to find some, like if they are looking for, I am a neurodivergent person, I'm looking for sensory support and some of those other things that my mental health therapist might not be able to provide, any suggestions or thoughts on how one might go about, or what they should be looking for in advertising or training that would help somebody to know this might be a potential fit?
Yes, I think that's hard to answer because it's going to differ a bit by country and
Mhm.
by funding systems
Yeah.
and all of
Mm.
those kinds of things. Like I know in the States, occupational therapists are not as big in mental health as they are here in New Zealand, in Australia, Canada, the UK.
Yep.
So I know that there's some quite big differences between countries,
Which
whereas
makes a lot of
OT.
sense because, there's different regulation around mental health in all of those different countries than there is in the US, where it's pretty highly regulated of who can do that and not. And
Yeah, yeah. So here, like, you will always see at least one OT on an acute mental health inpatient ward, at least one, if not like a whole team of them. So
Mhm.
OTs are really embedded in mental health. They still have issues with sometimes being in generic roles like case management and having to fight to bring the OT specific stuff in. But in terms of finding somebody, I think for me it's the same as looking for any other kind of therapist, right?
Mhm.
It's how are they representing themselves? What are they talking about on their website? Does it just look like they're being performative and using the
Yep.
buzzwords? Or is there evidence that this is actually what they do? Are they
Mhm.
listing every speciality under the sun, or are they actually going, I'm really good at just these things? Because for me, that's more likely to be a good fit than
Yep.
somebody who says I work with
All
these
of the things.
25
Yeah.
different things, right?
Yep.
I'd also look at the modalities. So especially for neurodiversity affirming, just there is some criticism of sensory approaches that work to desensitize. So just being aware in the languaging, like trusting your gut. And I know with interoceptive difficulties, sometimes we don't know what that is, but if somebody's talking about how they can cure you of your sensory sensitivity, run away, because
Mhm.
that's
Not
not
likely.
neurodiversity
Right.
affirming. That is behavioral
Mhm.
coercion.
Yep.
So you cannot do exposure therapy for a sensory sensitivity. It doesn't work. The
Mhm.
nervous system does not habituate, and you
Mhm.
actually create more trauma.
Yep. I was gonna say you
So
can
if
do it, but it won't be effective.
it won't be
It
effective,
will create harm.
you will make things worse.
Yep.
And so if you're, I guess, specifically on the example of sensory supports, looking for somebody who is willing to work with you to look at your sensitivities and where you might have to push through them because life is life. I have to go to the
Yep.
supermarket. I do the best I can, but I still have to go to the supermarket, even though I would
Mhm. Yep.
rather not.
How can I accommodate the most that I can given my circumstances? Mhm.
Yeah, so and with any of that, with executive functioning, with any of the planning, prioritizing, routines, looking at the languaging of how people are talking about that. Like if people are talking about, I've got one method that works for everybody, it's probably bullshit because no one method works for everybody. But if you're
Mhm.
looking for somebody who is talking about being person centered, flexible, supportive, just and like I do with my therapy, if you can't make a phone call, maybe send them an email, do a vibe check,
Mhm.
ask them how they're neurodiversity affirming and ask for examples,
Sure.
ask, state your
How
accommodations
would you
and,
work with this specific
how would
concern
you
I
work with
have?
this.
And yep.
So as with another kind of therapist, with an occupational therapist, I'd be asking the same questions. And yeah, are you coming from a supportive, accommodating place, or are you coming from I'm going to change the person and not the environment or the task? So yeah, for me, it's very much with neurodivergence, it's about changing the environment or the task and not the person.
Yeah, thank you for taking some time to kind of talk about that. I just, that as you were saying that, I think that's an important thing. And again, I was actually like angry when I like learned about all of this because again, I am somebody who like very much is aware of things. And so the fact that I had made it this far in my career and never once has anybody ever mentioned occupational therapy as like a potential support for people was mind blowing for me.
Yeah.
Um, and
Yeah. So I'm
so,
biased and I think everybody needs occupational therapy, of course.
yeah.
It is an amazing, when done right,
Mhm.
it's an amazing lens through which to support people, which
Mhm.
with, combining with social work, physio, psychology, whoever else somebody has involved, it can be an amazing thing that looks at the systemic picture and supports
Yeah.
the person being able to do
And
things.
my quick impressions would be, at least kind of within the US, I feel like we are not quite there. I mean, as you kind of said, I don't think it is as known or available. And what is there is a lot of those stereotypical kinds of work that those folks are doing. The other thing I have found is that, while I do think there's a lot of progress and a lot more movement for children in having occupational therapy and some neurodiversity affirming types of stuff with that, um, that is growing. It doesn't seem like, at least in the US, that exists at all for adults. Now,
It
I'm sure
doesn't,
you're in some bigger cities with well-resourced private. I'm sure there are some that exist, um, but like relatively few, right? And if they are, it's not advertised for adults, or people don't even have a clue where to find that, right? Because I'm
yeah.
even just in groups that I'm in that are more nationwide, I'm not seeing people come up with referrals and options, for those kind of things, as much. And I mean, I'm hopeful because it is growing, and as we keep, kind of the neurodiversity movement continues, I'm hoping that will continue to expand and it'll be more available. But that's kind of at least and I'm willing to be wrong, and others might have other views. Again, I'm limited in my state and such, but that's kind of
Mm.
my take on where we're at right now with it, at least in the US overall.
Yes, I think it's definitely growing, and there are some individual OTs doing some amazing stuff. Like there's Amy Wagenfield who's doing some amazing nature-based occupational therapy stuff. She's the only one from the top of my head that's doing stuff in the States. But so it is there. I think the OT has a bit of a PR problem. And so like we're getting there, but there's still a lot of people who don't know the breadth of what we can do. And there's some
Mhm.
amazing OTs around the world changing that. Carlin Neek in Canada is doing some amazing stuff. And Canadian OT has, their own models, and they're like doing some, really like foundational occupational therapy stuff has come out of Canada. Rhiannon Crisp in Australia she's got the OT lifestyle movement. So it's just about, there's kind of like your hospital straight OT, I don't know.
Yeah.
But, and then there's all these OTs who are outside the box doing things a bit differently. And they're the ones I'm connected more with.
Yeah.
And it's just fascinating to be connected in that way. Like at the OT conference here last year, I presented, which was great. But I met there's a OT here who specializes in pain management, and she's just learned she's ADHD. And so just these cool connections happening, I'm sure they do in any profession, but being able to know the different supports that are available, and for people to go, okay, there's more than just counseling.
Yeah.
There's actually these people who are trained to work on this real practical implementation
Yep.
side of things.
Yeah.
And maybe that could be helpful for me. But then again, funding comes into it, and access and availability. I live rurally as well, so that's most of my clients are online around the country because there's not a lot of people doing what I'm doing, and
Mhm.
I live in a town of 5,000 people or something. Like it's an itty bitty
Yeah.
place. So it is there. It's just you got to dig a little to find it.
Yeah. Yeah. And again, I appreciate kind of you taking some time sharing about that, because I think there's a lot for, folks who are listening just to learn about what's out there and available. And obviously, folks may have to do some research in whatever areas they're in and what's available to them. Um, And again, I think things are continuing to grow. So I'm really hopeful about the future overall around where things are headed in both kind of mental health and other spheres as well. So thank you so much for your time. I appreciate you.
Yeah, it's been lovely to to chat about mental health and therapy and all of the and occupational therapy. That was a nice little bonus at the end to be able to do a little bit of I love what I do. This is
Let you info dump for a little bit. I'm here for it.
so great.